Good health is a key contributor to the progression of the economy of any nation. Healthy people live longer and are productive in their contribution to the process of nation building. As the world wrestles COVID-19 and many countries under lockdown with the dusk to dawn curfew in Kenya, the question is how can populations in need of healthcare access it, especially in this duration? Dr. Sam Mahungu, who runs a healthcare service that provides home-based solutions, narrates how the service works and how we can tap into it, especially during the curfew hours.
I've always been attending to patients. I mean, neighbors, anybody who's sick. As they say, medicine is a practice. You will always practice, and that is the only way you'll retain your skills. But now, we've been getting quite a number of calls from far-off towns. So one particular case I remember, a patient called me all day from Donholm, and they sounded quite desperate for a medical doctor's attention. And I was really wondering now, if I continue providing the services at my own cost, to reach a point where it will not be sustainable. So what I requested the patient's father, if you cover for the Uber costs, are you okay with me just coming and just attending to you and really addressing the situation as it is? Because he was quite desperate. You could tell he really needed a doctor. And it was from that day that I actually realized what I need to do is find out a low-cost health service provision model, because you can also imagine there are quite a number of people who are really suffering economically and are also uninsured. So the only way really we can be able to reach these Kenyans is by packaging something that really can work for them and is responsive to their needs.
Sam says that Kairos Health Services has three key offerings: convenience, quality home care at affordable cost.
What Kairos is offering here is three things: convenience, affordable cost for health, and we want to fill in the after-sales service section or segment of the health value chain. Basically, our scope, to put it in summary or in a nutshell, is home-based care by licensed medical practitioners. And we're just not doctors. Cases that require other healthcare professionals to join us, that kind of connection, after-sales service aspect, is really our scope.
At Kairos, the plan is to decentralize the services to reach as many people with as little cost impact as possible.
We are reducing the cost of service provision because the amount of petrol or fuel you'd have used, for example, to go to the hospital, the amount of time you'd have spent, we're saving you on a lot of cost elements that you are currently incurring. Going forward in the future, we're trying to see how we can decentralize health services to local neighborhoods. For those simple diagnostic tests, simple tests that require simple diagnosis, we'll have the mobile labs with us, and prescriptions and drugs as well. So we are really we're really supporting our colleague doctors in a different way.
As Dr. Mahungu zooms off to attend to his patients who need him, we are grateful that in the end, we have a healthcare solution that will help us attend any health needs that might crop up during this curfew season. Even beyond this pandemic and the immediate interventions, it is a service that will prove useful to complement the health facilities as healthcare comes right into our homes. For Metropole TV, I am Fred Makori.